Normally, when a nurse calls me, if the patient's unresponsive or pulseless or something, I come running. This patient was getting somewhat combative and pulled out his IV, so confused, and the nurse said, "Can you come into room 5?" It happened to be that moment I just got a bad feeling, so I actually just went into the room immediately. Within seconds, I was there, and the nurse was facing me. The patient was behind her, and the patient was unresponsive and pale and looked like the patient was not breathing. It happened so quickly she didn't even know he wasn't breathing at that point. From the time she called me until I walked into the room, I checked his pulse. There was no pulse. He was not breathing, and so I started chest compressions. But while I was starting the chest compressions, I briefly looked up to the monitor and I saw what looked like to me something called a complete heart block for a very brief second. And then he went right into a flat line. So it happened just very quickly. And I started chest compressions, and we eventually got some IV reestablished. We did the advanced life support protocol, advanced cardiac life support, ACLS protocol, and including giving some epinephrine. We got him back pretty quickly. And initially he wasn't coming back mentally, so we were going to, in other words, he wasn't breathing still, and but his heartbeat and his pulse rate came back. I was going to intubate him, which means put a breathing tube in, and put him on the ventilator. But then he woke up shortly thereafter. So in other words, he was out for such a short period of time. His neurologic function came back very quickly. He was awake and alert. And I went back, and had I not looked at the monitor very quickly, I wouldn't have noticed he was in a complete heart block. So